Hello everyone, my name is Helena Vilaca and I'm going to present you my poster on the European regulation on medical devices. My work was implementation analysis in Portugal by the distributors. Distributors here, in this work I'm referring to both retailers and wholesalers. To briefly introduce you, this regulation was published in 2017 and it assures, its main goal is to assure that the medical devices that are marked in Europe are of high quality and safety. The policy analysis technique I used, which is the implementation analysis, is one of the most commonly used regarding policy analysis because actually the implementation is the phase of the policy that links theory to practice. Therefore, if we study the implementation of a certain policy, we can understand how good it will be on achieving its results and attending the original problems. Therefore, the objectives of this work were identify factors that influence the likelihood of successful implementation. This is indeed the implementation analysis. So to identify enablers and obstacles, explore the Portuguese distributors' opinions and perceptions towards these, understand the policy implementation process and its logic, and in the end, to have a picture of the implementation status in Portugal. This research method is qualitative, phenomenological, and to collect the data, I use document analysis and semi-structured interviews. Regarding the document analysis, I've studied and read legislation, guidelines and norms, and what we call the grey literature that corresponds to statements of opinion, workshop materials, position statements. Regarding the interviews, I've conducted 4 interviews of around 1 hour each, and my criteria to collect this sample was the criteria of convenience and of key informers. My results can be summarized on this table over here. In here on the left we have the analysis grid that was based on the literature review regarding implementation analysis. So these are generally the themes and subthemes or titles, subtitles that are seen when analyzing implementation of a policy. Therefore, here on this side of the table, the results correspond to both the documents and the interviews. And having in count all these results, we can draw some conclusions and learnings, such as that the regulation aims at the high level of public health, and both policymakers and implementers believe this brand, which is good because they are aligned. So these can be really well implemented and achieve its goals. There is also an incentive on the law harmonization, therefore it is good to have a regulation instead of a directive as before because it facilitates commercial trade as all the countries have a similar regulatory framework. There are some resistance points and obstacles, but those are already identified by health authority in Portugal, therefore they can be mitigated and solved. So in the end, we can say that the implementation is being smoothly conducted in Portugal. And this is it as a sum. So thanks everyone for watching and I'm available for any other questions.